This quick guide on treatment for symptomatic multiple myeloma will cover different treatment options such as immunomodulatory drugs, proteasome inhibitors, monoclonal antibodies, chemotherapy, steroids, stem cell transplant, maintenance therapy, clinical trials, and an overview of symptoms and side effects.
There are many different options for treating multiple myeloma. Your doctor should recommend a treatment plan customized for you, your goals, and preferences. People with asymptomatic myeloma may be followed closely but not yet put on active treatment. This is called active surveillance. People with active or symptomatic myeloma may begin with a combination of drug treatments, stem cell transplant, or a clinical trial. If you have symptoms, supportive care like bone strengthening drugs, growth factors to increase low blood counts, or kidney care can also play a role. This quick guide walks through the treatment options you may be offered depending on your diagnosis. Unlike other cancers, you can reuse a drug or drug combinations over time with multiple myeloma. The drug types used for first treatment for this cancer include immunomodulatory drugs, proteasome inhibitors, monoclonal antibodies, chemotherapy, and steroids. We'll talk briefly about each kind of drug.
Immunomodulatory drugs help the immune system find and attack multiple myeloma cells. These drugs are taken as a pill. The most commonly used immunomodulatory drug is Revlimid. It is often given to patients as part of their first treatment. It is also often used for maintenance therapy, which is given after patients have responded well to treatment. People taking these drugs are often given blood thinners or aspirin to prevent blood clots. New immunomodulatory drugs are being developed and tested in clinical trials.
Proteasome inhibitors cause myeloma cells to die. These drugs are either given as a pill, intravenously, or as a shot under the skin. Velcade is an example of a proteasome inhibitor approved for use as a first treatment for multiple myeloma. It is also often used for maintenance therapy, given after patients have responded well to treatment.
Monoclonal antibodies are made to attach to specific proteins on cancer cells. They help your immune system find and destroy multiple myeloma cells. These drugs are given by IV. Darzalex is sometimes given as a first treatment for multiple myeloma.
Chemotherapy kills fast-growing cancer cells. Unfortunately, it also kills fast-growing healthy cells, which cause unwanted side effects. Chemotherapy is given as pills or IV drugs. Cytoxan and melphalan are sometimes given in combination with other drugs for a first treatment for multiple myeloma.
Steroids in high doses are used to trigger the death of multiple myeloma cells. They can treat inflammation or swelling. Steroids can also decrease some side effects like nausea and vomiting from chemotherapy. For multiple myeloma, steroids are most often given as pills or by IV. Steroids can cause problems sleeping and mood swings. Let your healthcare team know if this happens to you. Steroids are often given in combination with other drugs for first treatment of multiple myeloma.
Another treatment option for myeloma is a stem cell transplant. This is not surgery, it's an infusion of blood-forming cells or stem cells. It allows your healthcare team to use higher dose chemotherapy to kill multiple myeloma cells than would otherwise be safe. This type of treatment can lead to a long remission. It can even be done more than once or after relapse. There are two types of stem cell transplants. An autologous or auto transplant uses your own stem cells, or an allogeneic or allo transplant uses healthy stem cells from a family member or matching donor. An autologous or auto stem cell transplant is most often used for multiple myeloma. To learn more about stem cell transplants, visit www.cancersupportcommunity.org/SCT.
Maintenance therapy is used for patients with multiple myeloma, especially if they have relapsed. It is given to patients whose cancer responds well to treatment and can prevent the cancer from returning. You will have routine tests done to keep track of how you are doing. Immunomodulatory drugs are commonly used for maintenance therapy. Sometimes proteasome inhibitors are used.
All people living with multiple myeloma at any stage should ask their healthcare team if there are any clinical trials they should consider as a treatment option. A clinical trial is a research study to test new treatments or to learn how to use current treatments better. Ask your healthcare team if there is a clinical trial that's right for you. You can learn more about clinical trials on the Cancer Support Community's website at www.cancersupportcommunity.org/clinical trials. Here you can also see a video with an example of how some clinical trials are using precision medicine in multiple myeloma.
In addition to your anti-myeloma treatment, you may be offered supportive care treatment to help with the symptoms of your disease or to ease side effects of your treatment. Common symptoms experienced are bone problems, anemia, infections, and kidney problems. For information on managing side effects from any kind of treatment, visit www.cancersupportcommunity.org/side effects. This is the end of this quick guide to treatment for symptomatic multiple myeloma. To learn more about these symptoms and how to cope, see our quick guide to coping with symptoms and side effects of multiple myeloma.